Good day, sir. I am Leslie de la Pasion from BSN 22 Group 2. So, this video remains the demonstration of oxygen administration via nasal cannula. So, first we have to do is the indicate the purposes of the procedure. First is to deliver the low to moderate levels of oxygen to relieve the hypoxia. And number 2 is to allow an interrupted delivery of oxygen while the client ingests food and fluid. And then next is for the assessment, the skin and the mucous membrane color, the breathing patterns, and then the chest movement, the chest wall configuration, and then the lung sounds if accurate by ausculting the chest and by the ear. And then for next is for the planning, assemble and assemble the equipment, the appropriate oxygen delivery system, the assuming that this is the nasal cannula, the flow meter, and then the no smoking sign, and then tape if necessary. And then next is for the implementation, review the chart for the physician's order for oxygen to ensure that that it includes the method of delivery, the flow rate, the titrations order, and then identify the client. So good day, ma'am. I am Leslie de la Pasion, your student nurse for today. So, ma'am, may I know your name?
Jeneline de la Cruz.
Okay po. And then next is wash your hands or apply alcohol to prevent infection control. And then next is identify the client and proceed with the 5 rights of medication administration, the right patient, right drug, right dose, right route, and right time. And next is explain the procedure to the client. So, yun po, gagawin ko po is lalagay, iano ko po yung oxygen po sa inyo via nasal cannula. And then next is assess the client to semi or high Fowler position if tolerated. So, ma'am, gusto nyo po bang ilagay ko po kayo sa semi or high Fowler position? Okay. Kailangan po. I-relax po natin yung ulo. So, next is for the nasal cannula. Insert the flow meter into the wall outlet or oxygen tank. And then, attach the oxygen tubing to nozzle on flow meter. Next is attach the oxygen tubing to the humidifier, and then next is turn on the oxygen at the prescribed rate. And then next is check that the oxygen is flowing through the tubing. And then hold the nasal cannula in proper position while prongs curving downward. and then place the cannula prongs into the nares. And then wrap wrap the tubing over and behind the ears. And then place gauze to the ear beneath the tubing as necessary. And then next is for the evaluation, assess for the proper functioning of equipment and observe the client's initial response to the therapy, and then monitor the emotion therapy by assessing for the pressure. And then next is perform the follow or based on the findings that deviated from the expected or the normal findings, and then identify the unexpected outcomes. And then for the recording and reporting, record and report all the pertinent information of procedure. And then next is record pre-procedure and post-procedure vital signs, and then document the evaluation of patient or the caregiver learning. So that's all for the demonstration of oxygen administration via nasal cannula. Thank you for watching.